What's your early reading, if any, on the activity on the exchanges so far, meaning based on who has signed up, who has not, what they've bought, and so forth?
Right. It's a little bit hard to tell because as you've seen and it's been publicized, the exchanges are off to a rocky start. And at one level, while that's unfortunate, it's not unexpected when you consider an undertaking of this size. So I think the numbers are relatively low because of those things. And like I said, many of the issues are actually making it difficult to really be sure about the folks who have enrolled and what they've purchased. But the process, working with the government, continues to sort of get the bugs out of the system, and I think over time this will likely improve, and with it you will see a ramp up in the overall enrollment.
Healthcare costs overall in the country have been rising the past few years at a lower rate than previously, but they're still rising faster than GDP, and that's not sustainable. What will it take in the big picture for these cost increases to become sustainable?
Right, to get this, I think there are two things, and I think these are the two things that are really going to shape the industry as well for the next couple of years. One is, I think fundamentally there has to be a new provider-payer model, one where our incentives are aligned with each other, and instead of focusing on activity, it's actually focused on the outcome. That would be one. And then second is, this is going to turn into a consumer marketplace. And I think with that, many of the effects, some of which we've seen already, will be brought to bear on the overall cost equation.
Right. Let's go down that road a little further, because that's a huge change. I mean, for example, Aetna's business primarily is with employers, medium-sized and big employers. I know it's the company's view that we are transforming to a consumer marketplace. What's driving that?
I think interestingly enough, there's a couple things. Certainly there has been a trend for a number of years, as costs have gone up, as you've indicated, that the employer has shifted more and more of that burden to the employee in that relationship. ACA in some ways was a catalyst event for this whole concept of an exchange. And as we talk a lot about public exchanges, there's also the notion of private exchanges. And I think as employers continue to wrestle with this, there will be more of a move to a defined contribution type benefit where the employer will give the employee a set amount of money. There will be a private exchange, and that exchange, then that participant will now really be a retail customer in making that purchasing decision. For us to succeed, we have to become a more consumer focused company. And it doesn't end with the buying experience that we just talked about, it ends with the whole consumer experience. So one of the things we're investing a lot in is making sure that there are the digital tool set for a healthcare consumer to use to help them navigate the system more easily, make an appointment on their iPhone to go get an MRI or something like that. But it's really improving and simplifying that consumer experience beyond just the buying experience.